first of our guaranteed preceptor techniques in session 3 is the 9th in our series of 16 techniques. This first technique I call no phone zone. The idea here is that phones should be silenced and put away other than for breaks. One of the things we've noticed over the last several years is that the advent of smartphones has totally changed the world, and most students are probably addicted to the use of their smartphones. In fact, most preceptors are probably addicted as well. But a preceptor has to realize that a smartphone, a student checking the smartphone for Facebook input or emails, instant messages, whatever the case may be, can be very distracting, especially in a patient care area. So strict limits need to be set on the student use of smartphones while they're on the rotation. Perhaps it will be restricted to certain times during the day or certain locations where it's okay for them to catch up on the information they've been receiving on their phone. But when they're on rounds in a patient care area or when they're meeting with a preceptor to discuss their patients, they should not be distracted by constantly looking at their phones. So some type of policy needs to be set forth by the preceptor. Texting, instant messaging, checking social media, emailing, all such activities can be very distracting to students and also disruptive to others. So other patient care providers in the hospital might be concerned about interacting with students who are constantly checking their phones when they are in the patient care area. Our next guaranteed preceptor technique is that minutes matter. Preceptors need to show up on time, and they need to expect their students to show up on time. If a rotation is going to provide an efficient learning experience, you got to minimize the downtime, the wasted time, as much as possible. If a meeting is called for 3 o'clock for a student to present patients to a preceptor, students should be held accountable to show up at 3 o'clock, and the preceptors should show up at 3 o'clock as well. If the students are supposed to be in the hospital at 8 a.m., they should be held accountable to show up at 8 a.m. Students need to understand during a rotation that time is important, and people in the hospital have other responsibilities than just providing them with training. So students need to be appreciative of that fact and pay attention to where they're supposed to be and when they're supposed to be there. It's up to the preceptor to set those guidelines to make sure that students understand that minutes matter. When John Wooden was coaching, his practices with his players were known for the detailed planning and the minute-by-minute execution of the practice. It was a stickler for making use of every minute during a basketball practice, and it paid off with those 10 national championships. Activities should be well planned and meetings should be organized to ensure the effective use of time. If preceptor is going to be meeting with students on a daily basis, the activities of those meetings should be well thought out. So there's not a lot of downtime when students are presenting to the preceptor. And they should understand that when they show up to a meeting with the preceptor, it's going to be an efficient use of time and held to a minimum. The preceptors can benefit from this type of time management, again, because they have many other responsibilities. And the time that's spent with students is going to take away from those other responsibilities. So it's not to say that students and preceptors shouldn't spend a lot of time together, but it's important for the preceptor to make sure that that time is well spent. I'd like to share some forms with you. Now, it may be difficult to read these forms. I'm showing them mainly as an example, and I'll highlight some of the aspects of these forms that I'd like to emphasize. So if you can't see the form extremely well, I'll somewhat walk you through it. I'm just trying to provide examples of the types of forms that can be very beneficial during a rotation. This first form is a drug information worksheet that a student would use to answer a drug information question. It's a commonly used form in rotations. You'll note at the bottom of the form it calls for a classification of the request. Now this serves a couple of purposes. To have the student fill this form out when they answer a drug information question, provide guidance to the student as to the proper sequence. It makes sure that they pay close attention to the classification of the nature of the request before they begin to try to answer it. This process of classifying the request also ensures that this exercise is going to optimize their use of critical thinking. Because in order to classify a drug information request, that request has to be analyzed. It's not possible to classify a request accurately without a careful analysis of the request itself. So it helps to ensure that the students are achieving the deep learning necessary that results from good critical thinking by forcing them to analyze the nature of their request. By documenting the nature, having to select from this list of possible classifications, that documentation is something that the preceptor can then evaluate when evaluating the overall performance of the student in answering the drug information question. So it guides the student and also facilitates the evaluation of the preceptor of the student's performance. This next form is a standard patient monitoring form. Now, every hospital's monitoring form is probably going to be different. In many cases, the hospital will have a standard monitoring form that is used. If by chance there isn't a standard monitoring form, the preceptor should develop one. The idea of a patient monitoring form is to guide the student to collect the proper information in the proper sequence and to document that information, and to be able to document information over a period of time to identify trends. So there may be an aspect of the form that enables the student to record laboratory data over several days, so trends can be apparent. Whatever the case may be, whether it's a special form that's developed by the preceptor or a standard hospital form or a hybrid of the two, the idea is for the form to guide the student's experience so it becomes second nature to the student as to how to monitor a patient over a period of time. This type of a form also makes it much easier for the preceptor to evaluate the quality with which the student is monitoring patients. It's much easier to take a quick look at the data gathered on a form to see how complete it is and how accurate it is, rather than spending a lot of time having the student explain to the preceptor what kind of monitoring they've been doing. So it increases efficiency for the preceptor and it increases learning for the student. This is an example of an assessment form. It's actually a form that I showed during session 2. It's a form for assessing a verbal presentation by a student. Now, if you see the third criteria on this form is enthusiasm, engagement, confidence, appearance, and comfort speaking. It communicates to the student that they're going to be evaluated on the nature of the presentation in terms of how much energy they put into it, whether they speak in a more energetic tone or if they speak in a very mild monotone that's difficult to hear. So it communicates to the student that we want them to have good volume, to speak clearly, and to have some energy as they speak. And they'll be evaluated on that. And one of the things I might point out, if you look at the rating of this particular assignment, there are 4 rating levels. We talked about this in the assessment discussions of session 2. There are 4 rating levels. If you can read the rating levels for enthusiasm, engagement, and confidence in that third criteria, the third assessment level, which is worth 7 to 7.9 points, says appear disinterested, distracted, and unengaged at times. The fourth level is described as unenthusiastic, did not seem to care, and distracted. I find it very difficult to distinguish between those 2 levels of assessment. This is an example of how using 4 levels of rating might be a bit too much. And I think the person who developed this form had a difficult time distinguishing between the third level of the rating and the lowest level of the rating. And it may have been better for this particular assignment to instead use a 3-part rating system that only required 3 levels to be defined for each of the criteria.